Hi, this is Jack Coleman with Southwest Washington Accountable Community of Health, aka SWACH. I'm here today at Children's Home Society in Vancouver, Washington, to hear from CHSW's Andy Tucker about their work with kids and families in Southwest Washington. Andy is CHSW's Community Director. He's also the co-chair of the Regional Health Improvement Plan Council, which develops health improvement plans in the SWACH region of Clark, Klickitat, and Skamania counties.
Children's Home Society of Washington got its start in the year 1896. It was a part of a national movement at the time, trying to find family homes for orphan children as an alternative to putting them in institutions. Children's Home Society of Washington has served Southwest Washington for over 60 years now. The services currently in the region fall into one of three main areas. The first area is still adoption. The second area that our services fall into we call family support. Basic assistance, food bags, hygiene bags, toiletries for families that are in need, and support groups for families. We run support groups for kinship caregivers. These are relatives that are unexpectedly raising relative children. And we also run the county's only LGBTQ specific support groups for middle and high school youth. The third area that our services fall into in Southwest Washington is behavioral health. And we serve families with children ranging from birth to 18 years of age, but our focus and our specialty is on providing evidence-based services to parents with young kids, especially young kids that have experienced adversity. We've learned a lot in the last 30 years about how a child's brain develops, and especially how the experience of stress can impact the development of a child's brain. When I talk about stress, I mean things like maybe being separated from a parent, or maybe the experience of poverty, or maybe the experience of abuse or neglect. And these kinds of stressors can be very predictive of negative health outcomes later on in life. For families with children in Southwest Washington, it can be really challenging at times to find stable housing. It can be really challenging to find, for adults to find gainful employment so that they can provide for their families. And it can be hard for families to access the right service at the right time so that they can reach their full potential. Harvard's Center for the Developing Child highlights three key ways based on the latest research that you can help children overcome stress and overcome adversity to get back on the right track. And there's nothing really that magical or fancy about these three things, but it's so important that the programs that you offer to children and family reduce stress, build life skills in family members, and strengthen family relationships. Because when you do those things, even kids who experience adversity can get back on the right track and thrive. We offer emergency basic assistance to families in the form of food or hygiene bags because we know that this will reduce stress and allow parents to be their best selves. We offer parent education courses for families because we know that when parents do their best, kids do their best. And finally, our behavioral health programming strengthens family relationships because we know that the single biggest predictive factor of a child overcoming adversity is a strong relationship with one competent adult. We live, unfortunately, in a society that sends the message that if you need to ask for help, you must have done something wrong. But the truth is that every family and every person throughout their life relies on the kindness and skills of others in order to be their best selves. And it's not always clear to families who they should reach out to when they need help or what help they even need. And that's why I think it's important when you have the opportunity, like at a pediatric primary care clinic where children are frequently seen, to screen for other needs that might be outside the scope of what you would typically be served for in a pediatric primary care clinic. And so we're thrilled to be pursuing a partnership with Child and Adolescent Clinic where we will embed one of our behavioral health therapists in their clinic so that that person can serve families who may not otherwise receive specialized behavioral health services in hopes that we can reach more children before needs become chronic issues and improve the overall health of Clark County. It takes a tremendous amount of courage for a family to reach out for help, and this is true for both healthcare, as I mentioned, and also families who need what we more traditionally call social services. Because the truth is that families might need help with a medical condition of a child or a parent, or families might need help finding secure housing or adequate employment or early learning services or childcare or educational support. And our vision at Children's Home Society of Washington is that we might be able to honor the courage of any family that reaches out to us for help and help them access services even if those services are outside of our walls.